nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, ladies and gentlemen. Good evening, Florida, my South Florida friends. And you know, we're really getting close to Thanksgiving, and the COVID situation has taken over. And I know a lot of you people want to get to see your family and friends. But unfortunately, you know, I'm going to take the advice of CDC. I'm staying home. And I think most of us should stay home to protect our friends and our loved ones. You know, this thing is going to be over shortly. As soon as we get that injection that everybody's going to take. So we got to be patient for a few more weeks, and let's just try to stay home and enjoy each other's company. You know, enjoy your family. If you got a few friends, stay over. But that's it. Tonight we have a great guest, and I hope she gets on. She's supposed to be calling in. Her name is Dr. Van. She's fairly new to South Florida. She's on. We're waiting for Dr. Van to come on. Dr. Van, are you around?
Yes, I'm here.
Okay. Can you hear me?
Yes, I can hear you.
Okay, wonderful. Dr. Van, I guess you're fairly new to South Florida, am I correct?
Yes, that's true.
You were from Arkansas?
Yes, I'm originally from Arkansas. I grew up there, graduated med school there, and then I moved to Florida for my training. And
I got to tell you, I read your bio. I can't believe the education that you have and that you're bringing to our future patients of South Florida. I got to tell you, I read this young lady's bio, and it just amazes me how brilliant she is. And she decided to go into family medicine. And if any of you folks are out there looking for a new family physician, I highly recommend you go see Dr. Van. Dr. Van, tell us a little bit about you. Tell us where you're working. Tell us your phone number, how they can get in touch with you, and your specialty.
Yes, so currently I'm working at a private clinic right now. It's called Sample Medical Center in Margate, Florida. Address is 5596 West Sample Road, Margate, Florida. Zip code is 33073. We're located in the Pepper Tree Plaza, and our phone number is 954-968-4000.
That's 954-968-4000. Now, if they call, can they get an appointment with you?
Yes, of course.
Okay. Now, tell us about that center that you're working at. What type of insurances do you take? You're taking Medicare, straight Medicare?
Yes, we do. We do.
You also take any other insurances?
Medicare. Yes, we take actually a lot of insurances. We take Blue Cross Blue Shield, United, Ambetter, Sunshine, just to name a few, Aetna, Oscar. Those are the big ones I can think on the top of my head right now.
You take United?
We take a lot more. Yes, we definitely take United. Okay,
so listen, this young lady, they take every insurance that you can think of. And again, I read her bio. Tell us a little bit about your education, because it just totally impressed me of how many degrees you have and how your specialty is. What made you decide to get into medicine after studying, biomedicine?
Right. So after I graduated college, I majored in biochemistry and molecular biology. And the school I went to was a liberal arts college in Arkansas called Hendrix College. And while I was there, it was a very heavy research institution, and I wasn't sure if I wanted to do pursue medicine or do a PhD degree. And so I got more experience. I after college, I actually took a break. I was a research tech for a year, and then I missed working with people, so I quit my job, and then I became a nursing assistant for a year, and that was the hardest job I've ever had. After that, I applied to med school. I didn't get in my first time, and so I decided to pursue a master's degree in biomedical sciences. So I did that, and then that was a 2-year program. After I did that, I got into med school on my second attempt, and and then I went to med school, and during med school, during all my rotations, all my experiences just kind of led me to family medicine.
So with all these degrees, I don't think there's any doctor out in South Florida that has as many degrees in bioscience or biomedicine that you do. So you pretty well know most of the body, don't you?
I hope so, but, I wouldn't put it past you. There are a lot of doctors that they've had so many experiences. I'm sure I've known a lot of doctors that have a pharmacy degree, a PhD degree. I feel like all these doctors are very well-rounded and have a lot of experiences. So I don't think I'm the only one for sure.
Is there any specialty in family medicine that you specialize in, or is it general family medicine?
I just do general family medicine, but there are a lot of fellowships that you can pursue after your training. Our training is about 3 years. After that, you can specialize in certain fields, such as sports medicine, sleep medicine. There's also, you can pursue a fellowship in OB-GYN if you wanted to, addiction medicine, even emergency medicine as well. So there's definitely a lot of avenues to go to with family.
So this young lady, I can tell you very honestly, again, I read her bio, and I highly recommend if you're looking for a physician or you're new to the area and you're looking for a physician, she's right down in Margate. Now how far? That's right off 95 and off of the Turnpike, isn't it?
Yes, sir, it is. It's we're very near Coral Springs and Coconut Creek too.
So you're probably 20 minutes from Boca, 20 minutes from Fort Lauderdale. She's probably 20 minutes away from you. So I can tell you, it's probably worth giving her a call again if you're looking for another family physician. Now, what ages do you take, doctor?
Oh, so we see adolescent to up. So we see about ages 12 and up, pretty much.
And what age do they start?
12 years old and up.
I couldn't hear that. Say it again.
Oh, I'm sorry. 12-year-olds and up.
So you could treat the whole family from 12-year-olds up.
Yep, exactly.
Okay, so listen, that's not too many physicians now taking 12-year-olds and up. So again, she's located at 5596 Sample Road, Margate, Florida. Her phone number is 954-968-4000. We are very fortunate that she did come to South Florida, and she's really, I think you're enjoying our weather down here, Doctor?
Oh, yes, it's very nice, especially around this time. It's getting a lot cooler, and I'm used to cool weather, and but I really like it that it's getting a lot cooler, and it's really nice here in December and January for sure.
Now a lot of people, doctor, are scared to go into the office because of this COVID. So I'm sure your office is taking all the CDC regulations as far as cleanliness, et cetera, in your office.
Oh yes, for sure. We make sure we sanitize every day. Also, after each patient, we sanitize. We also try not to see any patients that are actively sick, including having fevers or symptoms like loss of smell or taste. If we suspect that they are sick, we just do our visits by phone. So we do a lot of telemedicine visits, but we really try to keep all our sick patients out of the clinic and just do everything by phone. So it's safe for all our healthy patients, and it keeps everyone safe as well.
So you're doing telehealth phone calls, correct?
Yes, sir.
Okay, wonderful. That's wonderful. Well, we had a show last week about telehealth. I don't know if you listened to it, because we represent a company called American Telemedicine, which I'm just promoting that, which Peter should talk to you about, and that basically will give you Matter of fact, I went to the cardiologist today, and he said, I want to know more about that telemedicine thing, because on our telehealth visits, you really don't know what their vitals are unless they tell you, because you have no way of checking it. But with American telemedicine, you know up to date what their vitals are immediately. So it's a true, real. It's almost, you do a complete triage with that patient right in his home. So Peter will probably talk to you about our telehealth program that we do jointly with the All County Healthcare. So, again, that's what a lot of physicians are doing now, telehealth. So she's available for a telehealth phone call for you. Now, are you doing any COVID testing in that office?
No, no, we do not do any COVID testing here, but we do. There are a lot of places nearby us that do COVID testing for free, and it's put on by the Florida Department of Health. And so we advise, we have a lot of places where we can advise patients to go get testing.
Are you affiliated with any hospitals in that area?
I do have privileges. At Northwest Medical Center, just down the street from us. We try to provide a lot of continuity in our care. So any of our patients from our clinic that get admitted to Northwest Medical Center just down the street, I go see them.
Okay, that's great. So she has availability for hospital privileges. That means that if you do get sick and you do have an emergency, she can advise you to get over to Northwest or any hospital that you so to choose, because they're treated with hospitalists, aren't they, doctor?
Yes, yes.
Hospital has their own hospitalists. They report back to you, correct, as a family physician?
Well, actually, I am the hospitalist. I will admit the patient, or if the patient gets admitted from the ER, they contact me and tell them that they're one of my patients or Dr. Gupta's patients, and I actually admit them myself and take care of them myself in the hospital. And then I'm also responsible for discharging them and everything, and then I see them back in the office. So I actually do the whole thing.
So you do the whole thing. So you almost got concierge medicine right there.
Exactly.
Without paying the big numbers.
Yeah, exactly. And I recently saw one of my patients a couple of months ago, and it was very rewarding because, she was very surprised to see me in the hospital taking care of her. And I came on the weekend and also saw her. And so it was just very rewarding to the patients for, me to be there for them, that I can see them both inpatient and outpatient.
One of the biggest complaints I hear, Doc, is that a lot of times these patients go in to see the physician, or they get to see, they don't see the physician, they can see a physician assistant or a nurse practitioner who they happen to be very good at their job. But when they want to see a physician, they say, well, that physician only put 10 minutes with me, 5 minutes with me. Will you take as much time as that patient needs to talk to that patient about the problems?
Of course. Every patient that comes in, I try to reset and I try to make sure I give them all my attention and time. Of course, some visits are going to take longer than others, and if I feel like a patient needs a little bit more time, we can always adjust the schedule for them to have a longer time with me. I don't ever want to make the patients feel rushed, or, if they have multiple concerns, I always tell them, maybe we can tackle the top 2 or 3 today, and then I bring them back so I can address their other concerns, because I don't want any concerns to go unnoticed. So that's kind of my strategy. I feel like a lot of family physicians are kind of limited with time, and they want us to see a number of patients in a short amount of time. And so I try to make it efficient as possible, and I also try to make the patients feel comfortable, as well as I want to make sure that they're also being listened to as well.
See, that's extremely important, especially when you're dealing with elderly people or younger people. They don't have the knowledge. And every time a patient goes in to see a physician, they're a little nervous. They anticipate the worst. Oh, what kind of test are you going to give me? Is everything all right? And if there is a problem, you also have a referral source to refer them to some specialists. Am I correct, doctor?
Oh, yes. We do our best to communicate our treatment plans, and if we feel that it's out of our scope of practice, we will definitely refer to a specialist. And we definitely have a lot of specialists that we have relationships with that we will refer our patients to. So yes, my staff is very great in getting referrals done, and they're very efficient and they're fast, and so I feel like our office does a very great job with that.
Doc, we're going to take a 30-second break. We'll be right back. Don't go away. I got to put a little commercial in for All County Healthcare. So we're going to that little commercial. We'll be right back to talk to you.
Okay, sounds
Hold
great.
on.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
We're back, Doc. We're back with a little 30-second commercial. And in that commercial, we had a little thing called IPV, interpulmonary ventilation therapy for COPD patients. Now, I'm sure you see some COPD patients, and I'm sure you see some bronchial patients, because right now, this time of year, a lot of the respiratory problems are occurring. Do you see a lot of pneumonia patients and COPD patients?
We do have a number of COPD patients and asthmatic patients. As far as pneumonia, usually they are more severe, so we would see them more of an inpatient setting. But yes, we do have a lot of those. And you're right, like during this season, a lot of them sometimes do get attacked, from the environment, the weather changing, and they tend to come in the office during this time.
Yeah, we're one of the. I've just put a little plug in for All County, as I have to. They're the only company right now that can treat COPD at home. As a matter of fact, they just done a study that kept them out of the hospital for over 12 months. So it's amazing because, COPD patients sometimes frequent flyers back into the hospital. Anybody with respiratory disorders. So there's many things that we do at All County. One of those things is that COPD we specialize in. So, Doc, tell us a little bit more about you. You came down here from Arkansas. And how long ago did you come down here?
So I actually came down here about 3.5 years ago. Mm-hmm. I was in Arkansas, and then at the end of med school, you enter this system called the Match. And what it does is it matches you to your specialty around the country, and you interview at a bunch of places, and you rank them. I decided I wanted to go somewhere in Florida because I didn't want to stay in Arkansas because I pretty much grew up there. I wanted to go and explore somewhere new, and so I have a lot of family here in Florida, and I always thought it was good to have a good support system, so I decided to apply to a lot of programs in Florida, and I ended up in Daytona Beach, and so I was there for about 3 years, and then also I met my husband about 3 years ago, and so he is from Florida, or Miami actually, and so after I graduated from my training, I decided to move down here to be closer to him and his family.
Well, I got to tell you, I'm so impressed with her resume that if you're really, again, looking for a physician, you're new to the area, you're coming down from New York or Chicago, you're getting out of that cold weather, you're trying to avoid the COVID up in New York or wherever you're at, because we're right now having a tremendous housing boom in Florida. Houses don't even stay on the market a few days. So these new people are coming in. You're going to be looking for a physician. And if you do looking for a physician, please give Dr. Van an opportunity to at least talk to her. Go get some consulting. If you need a physician, a family physician, remember, she can take the whole family from 12 on. That means husband, wife, children from 12 up. So it's a great place to have one physician for the whole family. And she knows, matter of fact, it's like concierge medicine. You don't even have to pay the $1,500 because she follows you all the way from the hospital back to her office, wherever you get sick. And I guess, again, she does telemedicine visits. So if you visit her, she becomes one of her patients, and you need a prescription, she can talk to you on via telemedicine. So she has all the assets of that. And again, we're so lucky to have her down here. So again, doctor, you are a family physician treating everybody. We love to have you down here. And the question is, your other specialty is that now you treat. I see you're a female, so you treat men, women, children, correct? Everybody.
Yes, exactly. We do not discriminate. We treat everybody, regardless of their race, gender, orientation.
So
we love to take care of everyone.
And again, her phone number is 954-968-4000. She's at 5596 West Sample Road, Margate, Florida, and that's not too far, probably 20 minutes from Boca, 20 minutes again from Fort Lauderdale. And we have about 3 minutes, Doc. Tell us a little bit more what you'd like to let the patients know about, what you want them to know about you.
Well, I guess, what I want them to know is if they're looking for a primary care physician, please come see me. I'll be happy to take care of you, and I'll make sure, your concerns are listened to. We have a great office. We have another physician in my office as well, Dr. Gupta, Nina Gupta. She's been in practice for over 30 years. Mm-hmm. She's such a great mentor. We also have a really amazing staff and very efficient. I've heard a lot of patients complain about other primary care offices where, they don't pick up the phones, but I can promise you, our staff is very perceptive, and they're efficient, and they'll make you feel like your family. Also want people to know, please stay safe during these holidays as well. Definitely with COVID numbers increasing. But I wish everyone a really great Thanksgiving. Thank you so much for having me on this show.
Oh, we're lucky to have you. Now, let me ask another question. If someone calls, does it take long to get an appointment?
Oh, not at all. We are definitely accepting new patients. Dr. Gupta usually works in the mornings, and I'm there in the afternoons, and our schedule is pretty open. So we take same-day appointments and walk-ins, so we can definitely get you in that day.
So you even take walk-ins?
Yes, we do.
Well, that's fantastic. So, listen, there it is right there. If you need a doctor right away, there she is, Dr. Van. She's right there at Margate. Mm-hmm. She's willing to take you immediately the same day. So, listen, instead of going to one of these emergency centers, go into a young lady who has tremendous bio. She has tremendous knowledge about the human body. I highly recommend that you go and see Dr. Van. Doctor, it's a pleasure to have you on. Do we have any more time left? We don't have any more time left? Doctor, we'd love to have you on again. And if there's anything we can do for you, please let us know. We like to help new doctors in the area, help promote business. Now, would you don't do any house calls, do you, Doc?
House calls? No, unfortunately not.
Huh?
House calls?
We'll talk to you another time. Thanks again for coming on.
Thank you
This
so
is
much.
Lou Biazzi signing off for you and your doctor. Live longer and healthier.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.